We begin today with a reality check on the Affordable Care Act and the dramatically rising cost of health insurance for ordinary Americans. According to independent research, millions of people are watching their premiums skyrocket to new highs this year. There's also a reverse impact for some who used to have policies but can no longer afford them under Obamacare. For them, it's a case of costly care. When you first heard about Obamacare, were you excited at the idea you might be able to afford some good insurance?
Oh, at first I was. And then I just got so disappointed with it.
Janet Hill is a professional transport driver in Fernandina Beach, Florida. When she took a new job that didn't provide insurance, she priced out policies and got severe sticker shock.
They told me it'd be $400 or $500 a month. I cannot afford that.
Hill joins an emerging class that's an unintended side effect of the Affordable Care Act, the newly uninsured. It's not part of the rosy portrait painted by President Obama.
Up to 129 million Americans with pre-existing conditions no longer face the risk of being denied coverage or being charged more just because they've been sick. 137 million Americans with private insurance are now guaranteed preventive care coverage.
Under Obamacare, a new reality is setting in. More people have health insurance, but for millions, policies cover less and cost more. Nathan Nascimento is a senior policy advisor at Freedom Partners, a libertarian-leaning nonprofit that opposes Obamacare.
People are seeking out insurance plans, but what they're realizing is they just can't afford the monthly premium, and they just can't afford the deductibles and out-of-pocket costs. What good is having a health insurance coverage or an insurance card in your wallet if you can't afford the treatment that you're getting?
Nascimento says it's turning out just like the fictional Harry and Louise worried it would in a 1994 ad campaign opposing health care reform.
This was covered under our old plan.
Oh, yeah, that was a good one, wasn't it?
Things are changing, and not all for the better. The government may force us to pick from a few healthcare plans designed by government bureaucrats.
The ad, sponsored by an insurance industry coalition, helped defeat so-called Hillary Care, promoted by then First Lady Hillary Clinton.
Having choices we don't like is no choice at all.
Yeah, they choose.
We lose.
What they were saying back then is exactly what we're experiencing right now. The fact that healthcare costs are going to go up, that out-of-pocket costs are going to go up, that government-run healthcare is going to be a failed model. And that's what we're seeing exactly today. We're seeing people being harmed by the Affordable Care Act.
Here's how the numbers stack up. The vast majority of the newly insured, 10 million, are people now allowed to get insurance from Medicaid, taxpayer-funded insurance for the poor. The Affordable Care Act expanded Medicaid to people making more money than before. Another 10 million Americans who earn too much from Medicaid still get taxpayer help to buy insurance in the form of Obamacare subsidies. Everyone else pays full price and must choose a bronze, silver, gold, or platinum plan. Bronze plans have the lowest monthly premiums, but large deductibles. At the other end, platinum plans have high monthly premiums, but smaller out-of-pocket responsibilities. Most Americans have silver plans somewhere in between. Last week, President Obama touted the supposed affordability.
Most folks buying a plan on the marketplace can find an option that costs less than $75 a month.
But we looked at the numbers for 2016, and in no state could we find average policies priced even close to $75. Washington, D.C. has the cheapest silver premium average at $203. The national average is close to $300. That's according to the private health nonprofit Robert Wood Johnson Foundation, which finds overall premiums are up more than 12% in 2016. States hit hardest according to the data: Hawaii, Montana, Minnesota, and Alaska, all with average silver plan premium increases above 30%. Alaskans are paying $169 per month more than last year. North Carolina, Utah, Kansas, West Virginia, Tennessee, Oklahoma are all seeing hikes between 20 and 30%.
What we've seen is that most states, 49 out of 50, are seeing premium increases. The only state where there was a decrease was Mississippi, and that was slight. It was 0.2%. 17 states are seeing double-digit increases. There are some states that are seeing a 30% or higher, including Minnesota, which is nearing 47, almost 48% premium increases for the upcoming year.
Yet as recently as October, the Obama administration quoted a 7.5% increase and said most consumers would find plans for less than $100 a month. Premium hikes are only half the burden. Deductibles are up too, 7.8% this year on average for silver plans, worse in places like Mississippi with an average 42% increase, working out to $1,473 extra for the year, and Washington State averaging a 47.6% increase, or $1,090 more in that state. No matter how much it costs or how little it covers, having insurance is now the law, and more have gotten insured.
As the Affordable Care Act has taken effect, nearly 18 million Americans have gained coverage. In fact, for the first time ever, more than 90% of Americans are covered.
I think the Obama administration is trying to save a law that they know is failing everybody. First and foremost, the Obama administration has always put the emphasis on their metrics of success, which is putting an insurance card in everyone's hand. The premium increases was less important to them.
In round numbers, 10 million have gotten expanded Medicaid, 4 million people have picked up insurance buying their own policies, and 3 to 4 million are young adults covered on their parents' plans. But nobody's counting how many previously insured are now going without, like Janet Hill. She's paying a price, a $325 penalty tax in 2015, $695 this year.
And so you're going without insurance.
Exactly.
There's a penalty that comes with that.
I'm aware of that.
You're just going to have to pay the penalty.
That's all I can do. I cannot afford insurance.
There's another downside. She broke her shoulder and says she just has to live with it because doctors won't see her without insurance.
And meantime, you have a broken shoulder?
Yes, it was fractured because I don't have no insurance. They do not want to take me. So I've just got aggravated and said I'll deal with it myself.
The Congressional Budget Office now says the Affordable Care Act will cost nearly $2 trillion over the next 10 years. That doesn't count the estimated $7 billion in taxes spent on the various websites, and it doesn't count the individual costs many Americans are paying as their premiums and deductibles rise. Today we begin with the story of an investment advisor from Philadelphia who stumbled onto one of the biggest stories about the Affordable Care Act to date. His name is Rich Weinstein, and he helped expose a startling set of videos that changed how many Americans view Obamacare. Though publicly available, these remarkable videos have only rarely been seen, getting just a few hundred clicks. On them, a key Obamacare advisor admits they intentionally misled voters whom he called stupid. Today, Weinstein tells how he dug up the videos as a citizen journalist and warns of more trouble ahead.
Back in 2013, I was a victim of, if you like your plan, you can keep your plan. So late in 2013, we got the email notice from the insurance company saying that our plan was no longer ACA compliant. I had believed at that point that I wouldn't lose my plan based on what the administration and everybody was saying about the Affordable Care Act. At that point, I kind of decided to get involved and figure out what was really going on.
So Weinstein got on the internet and started digging. What he found was a group of Obamacare advisors referred to as architects.
I started noticing more in the news that these people called architects were out there basically trying to influence public opinion. And I figured these architect people were mostly academics, and I thought maybe they would leave a trail of breadcrumbs for me to figure out what was going on.
The breadcrumbs led to revealing videos in the public record, but largely unknown to the average American. One star in these videos was Obamacare architect Jonathan Gruber, an economist at the Massachusetts Institute of Technology.
Look, I wish Mark was right. We can make it all transparent, but I'd rather have this law than not.
In a series of remarkable policy talks at conferences and in academic settings, Gruber seems to brag that Obamacare only passed through its lack of transparency and the stupidity of voters. For example, Gruber says he and other backers of Obamacare hid the fact that it would be costly to healthy Americans.
If you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay? Just like the people, lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass. What I mean by that is what the Affordable
But it's another Gruber video that Weinstein says made him shiver, a video that foreshadows a little-known sea change in U.S. tax structure mandated under Obamacare.
When I realized they were going after that, the hairs in the back of my neck stood up. Like, why haven't I heard this before?
It's a very clever, basically exploitation of the lack of economic understanding of the American voter.
When he's talking about the lack of basic economic understanding of the American people, when he's talking about the American people being stupid, he's pretty much talking about the Cadillac tax.
Weinstein wondered, what is the Cadillac tax? That was explained in another video he discovered, this one featuring Obamacare architect Ezekiel Emanuel in 2014. Emanuel said the Cadillac tax would go after a little-known tax break millions of Americans get on their work insurance.
It is the single biggest tax break in the American tax code. It's worth $250 billion. To compare, for those of you who want to keep track, the mortgage deduction, sacrosanct, $70 billion.
And it took me some time to figure it out, but I realized that they were going after that tax break and not, people were going to lose their tax break without knowing they were losing their tax break. It's incredible.
Weinstein learned that since World War II, Americans' health insurance benefits from work haven't been taxed as income. The Obamacare Cadillac tax will change that. It slaps a 40% tax on work-provided insurance policies valued above $10,200 for an individual or $27,500 for a family. For example, say your individual plan costs $15,200. You'll pay 40% of the amount over $10,200. That's 40% of $5,000, which means an extra $2,000 to the IRS at the end of the year. In another video Weinstein found, Emanuel describes how he had to convince President Obama and his political team to support the tax.
The other side, inside the White House, the other part of the health team, and especially the political team, which David Axelrod headed up, hated this idea.
One reason they hated it, Emanuel explains, is because in 2008, Obama's Republican opponent, John McCain, proposed eliminating the tax benefit, in effect imposing a giant new tax, and at that time, Obama was against it.
John McCain calls these plans Cadillac plans. Now, in some cases, it may be that a corporate CEO is getting too good a deal. But what if you're a line worker making a good American car like the Cadillac? What if you're one of the steel workers who are working right here in Newport News? And you've given up wage increases in exchange for better health care. Well, Senator McCain believes you should pay higher taxes too. The bottom line, the better your health care plan, the harder you fought for your good benefits, the higher the taxes you'll pay under John McCain's plan.
But now, under Obamacare, he'd be imposing exactly what he criticized McCain for proposing, a massive tax hike on American workers' health insurance. Emanuel would later reveal how it took some convincing to get the president to go along.
The president campaigned against John McCain, who wanted to get rid of the tax exclusion entirely, with over $100 million worth of ads saying, the Republicans are going to tax your health benefits for the first time ever. And this was an anathema. The president was going to go back on his word.
They wanted to get at your tax break, and they couldn't do it overtly because Senator Obama in 2008 spent $100 million destroying John McCain.
Emanuel goes on to say in the video that he helped convince President Obama to impose the Cadillac tax on American workers with the idea that it would reduce health care costs. But how to convince the public to accept a huge new tax? Gruber says they decided to use wordplay. The public would be told it was a tax on insurance plans rather than consumers.
Calling it a tax on insurance plans rather than a tax on people, and we all know it's really a tax on people who hold those insurance plans. We said, well, that's pretty much the same thing. Well, why does it matter? I said, you'll see. And they were posted and that passed. Because the American voter is too stupid to understand the difference. We just tax the insurance companies. They pass it on higher prices. That offsets the tax break we get. It ends up being the same thing.
They were going to be able to tax the American public, but not call it a tax on the American public.
Well, they were going to tax the American public without the American public knowing it was a tax on the American public because they were going to put the tax on the insurance plan, which would then be passed through to the American public through premium increases.
After some of Weinstein's stunning video discoveries were reported on the news in 2014, Gruber apologized and called his remarks inexcusably arrogant.
In excerpts of these videos, I'm shown making a series of glib, thoughtless, and sometimes downright insulting comments. I know better, I'm embarrassed, and I'm sorry.
Both Gruber and Emanuel declined comment for this report. President Obama has said he does not agree with Gruber's assessment of the American public's intellect and that the former advisor's views do not reflect the process. The White House wouldn't offer further comment. As for Weinstein, he sees the future, not because he's clairvoyant, but because the Obamacare architects laid it all out in those videos. He says the looming Cadillac tax will cause employers to drop insurance plans. More Americans will be forced to buy policies on the Obamacare exchange, where premiums and deductibles are quickly rising.
And the high-wage employees will not have the benefit of a subsidy. The lower-wage employees will, which turns a regressive policy into a progressive policy. I kind of jokingly refer to it as the Super Bowl of progressive politics, because you're going to go from regressive to progressive, and people aren't even going to know what hit them. Everything I know about this came from people on the left. It came from Jonathan Gruber. It came from Zeke Emanuel. It came from other architects or other academics. It's their words, and that's kind of the strength of what I've been able to find. My words really aren't important. It's their words. It's all there on video.
You know, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass.
The Cadillac tax was supposed to start in 2018, but as word of it has sunk in, it's become so unpopular among Democrats, Republicans, corporations, and unions that Congress voted to postpone it until 2020. Problem is, many employers are already anticipating it and adjusting by downgrading or even canceling policies they offer at work. In the past 3 years, the Affordable Care Act, or Obamacare, has expanded free health insurance to millions of low-income Americans and is helping pay the cost for millions more at taxpayer expense. But it's no secret that for many others, premiums have skyrocketed, benefits have declined, and they've lost their doctors. Just this week, the Obama administration revealed premiums will rise an average of 22% next year. In Arizona, the cost of some plans will increase 116%. With enrollment for 2017 beginning on Tuesday, we investigated and found that Obamacare is in critical condition, leaving a dire outlook for the nation's health insurance system. Virginia health insurance broker Ed O'Brien helps match up customers with the right policies.
It's not working. Clearly, it's not working.
A task that's become much tougher, he says, under Obamacare.
Your average person who makes $30,000, $35,000 a year cannot afford a $10,000 deductible and an out-of-pocket that's even higher than that. It's simply not sustainable or affordable.
Kara Acorn says Obamacare has been especially hard on her mother, who wasn't offered insurance at work.
She personally had to purchase her plan through insurance, through Obamacare, and she had diabetes and some other health care concerns, and her plan was just, she could barely afford it. It was so unaffordable. They call it the Affordable Care Act, but it was actually the opposite for her.
You know what? I told them not to call this the Affordable Care Act.
You told who?
The Obama administration, the Democrats, every Democrat I could find.
Robert Leshefsky is a policy advisor and analyst for the insurance industry. He's correctly predicted Obamacare's pitfalls since day one.
The future is not good. The fundamental problem is not enough healthy people have signed up to pay for the sick, and not enough healthy people have signed up because the insurance plans that people are being offered just simply aren't of good value.
What do customers see as wrong with the insurance product?
The insurance products that consumers see are still too expensive in terms of premium, and the deductibles and copays are too high.
Can you explain in simple terms how the insurance companies are losing so much money if they're charging so much for premiums and if deductibles are so high?
It's real simple. If you only provide a health insurance plan that the sickest people buy, you can't charge enough. You can never charge enough.
The rates are getting such that people are saying, I'm just simply not going to have health insurance and I'll pay the penalty because I just simply can't afford the premiums, and I'll take my chances of being uninsured and paying the penalty, which defeats the purpose of the Affordable Health Care Act.
Lena Simmons says she's lucky to have good insurance through her teaching job. She knows others facing a hard reality.
If you're working for a city job, you have health care. But if you're working for a job in a pizza place or a retail center, it's expensive for them to give you quality health care.
It's expensive, say experts, because nearly all of the government's plans to increase competition have backfired. Take the abysmal failure of the Obamacare co-ops. 23 nonprofits started up with your tax dollars. After sometimes paying exorbitant salaries to their executives, they've gone belly up one by one.
There were 23 and 17 have gone broke so far.
And that's our tax money that went down the tubes.
About $3 billion when it's all over, yeah.
For-profit insurance companies are jumping ship too.
Like Aetna, Humana, United Healthcare, some Blue Cross plans pulling back, a number of Blue Cross plans losing substantial amounts of money and having to go after major rate increases to stay in the business.
Earlier this month, Obamacare critics were surprised to hear agreement from an unlikely source, President Clinton on the stump for Hillary.
So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
The White House declined our interview request. Last week, the president acknowledged Obamacare's troubles, but said his signature health care plan can be fixed instead of scrapped, like a smartphone that was recently recalled for catching on fire.
And think about it, when one of these companies comes out with a new smartphone, then it has a few bugs. What do? They fix it, they upgrade it. Unless it catches fire, then they pull it off the market.
But the president continues to call the Affordable Care Act one of his administration's key successes.
Because of Obamacare, another 20 million Americans now know the financial security of health insurance. So do another 3 million children. And the net result is that never in American history has the uninsured rate been lower than it is today.
Is it true that more people have health insurance today as a result of the Obamacare plans?
It is true that more people have health insurance today because of Obamacare, particularly because of the Medicaid expansion in the 31 states that have taken it.
Richard Fuertes says he's delighted by the options available in the U.S. compared to where he comes from in the Philippines.
I really to be thankful and appreciate it for me, for myself.
Obamacare has also opened up affordable insurance to many with pre-existing medical conditions, illnesses that once made it impossible for some to get affordable insurance.
A lot of people were able to get insurance that couldn't get it before because they had pre-existing conditions. I suppose in some respects that was a good thing. Unfortunately, these pre-existing conditions, which aren't looked at any longer, have caused insurance rates to go up, at catastrophic rates.
In the insurance industry, it's called the death spiral. Not enough healthy people sign up to pay for the sick. Premiums have to go up, so more healthy people drop their insurance. Premiums for those left have to go up again.
The lowest income people in Obamacare are the ones that benefit the most. They get the highest subsidies, and their deductibles and their copays get subsidized. So if you look at the very lowest income people in Obamacare, 82% of them have signed up. That's terrific. That's a terrific pool. But then if you look at the people between 300% and 400% of poverty, the people that start moving up toward middle incomes as a comparison, only 17% of them have signed up. So I think part of this program is in a death spiral already.
Earlier this month, Minnesota Governor Mark Dayton, a Democrat, backed off his staunch support of Obamacare after sticker shock cases, like one family of four learning they'll have to pay $40,000 in premiums next year with a $13,000 deductible.
Ultimately, I'm not trying to pass the buck here, but the reality is the Affordable Care Act is no longer affordable.
At its core, it was supposed to provide affordable insurance for everybody who needed it.
Yes. The Affordable Care Act was supposed to ensure that whether you were employed or unemployed or self-employed, you would have access to affordable health insurance. For someone who's not getting a subsidy, who's paying the full cost of insurance, it's likely that they're now paying about double what they paid before, under the old market where only healthy people could get in.
Anytime you make a law that forces someone to spend their hard-earned money on something, it gets pretty tough. We're just not in a I think as a whole country, we're just not in a place where we can be told we have to spend that many hundreds and hundreds each month, especially if you have multiple people in your family. It's a huge sacrifice.
Leshevsky and other experts say Obamacare is already a failed experiment and predict that without a major fix, it will implode by the end of next year.